Hello! How would you like to spend less on your healthcare, yet notice that your healthcare provider is spending more time with you and overall you're getting a better quality of care? I'm Dr. Jack Silvers. I'm a board-certified dermatologist practicing at 11980 San Vicente Boulevard in the beautiful Brentwood neighborhood of Los Angeles for the past 18 years. Doctors pay about 30% higher in rent than other service providers across Los Angeles. And I bet that is the case in all metropolitan areas across the US today. One reason is that there is a shortage of medical office space, and this shortage is artificial. Let me give you an example as to why there is a shortage. At 11980 San Vicente Boulevard, 65% of the rentable office space is occupied by therapists, psychotherapists. There was a time that it was taboo to see a therapist. Today, it's a taboo not to see a therapist. And this building 11980 has been leased 100% for years, so the landlord keep raising the rent and can charge whatever he wants. Many specialties, many medical specialties have moved out of the building, and the rentable area of where there are windows has pretty much been occupied by dentists and therapists. Now you may ask, why would so many therapists be condensed in this building? Well, if a therapist were to move to a non-medically zoned Class A building with plenty of parking space, that building would have to show to the city that it has 5 or 6 parking spaces per 1,000 square foot of the therapist's office to the city. And that makes it prohibitive for many Class A buildings to have that much parking space. You may ask, well, does 11980 have 5 parking spaces per 1,000 square foot rentable area? No. Because it's a medically zoned building, it doesn't have to show to the city that it has that much parking space. And as a matter of fact, it absolutely doesn't. Now, a therapist, acts like a consultant. They see one patient every hour or two. They don't have any medical assistants. They don't have any front desk staff. Other medical vendors don't go in and out of their office. So why do they have to be bound to a medically zoned building? It's just a tradition, maybe it's a comfort. Maybe there was a time that therapists were a small fraction of the entire healthcare provider community in pretty much all buildings, but that is not so today. And I am making a petition to ask the city to change the law so that the therapists would need as much parking space as attorneys, 4 parking spaces per 1,000 square foot of their office. And I think this would lower the demand for medical office space. Then just because it's a demand and supply issue, the doctors would be charged less. If the doctors have to pay less rent, then they would spend more quality time with patients, or at least most of them would. Most of the doctors would spend more time with continuing education activities and can provide you with more up-to-date and quality care. Please look into this. I would be glad to answer your questions. And join me in making this happen. And this is a change that's in your hand, and it's easy to do and achievable. Thank you for your time.